got lead nurse Mary, who's so excited to be here.
So excited.
And we're going to talk today about key treatments for long-term results. Hi, Dr. Tom.
Hi, thank you, Michelle, and welcome, Mary.
Welcome to myself. Thank you.
Michelle's kind of teasing Mary a little bit because Mary is our lead nurse. She's been amazing. She has really helped to develop our program and does wonderful work, and we've been working together for how many years, Mary?
16.
16? Are you sure it's not 17?
16.
16 years. Yeah, whatever she says is right. Okay, so we've been working together for 17 years, and I have to drag Mary to the radio station because radio's not her favorite thing to do, but thank you for coming
But
today.
I come.
But you come, right. And so I know, so Mary, you're an RN. Before you came to work for us, what kind of nursing did you do?
I did primarily dermatology.
All right.
Yes.
And so that's really great. You know, we have Bridie, our medical assistant, who worked with my good buddy Dale Westrom, dermatologist, and Dr. Susan Amatoro, implant, and she came over to join us.
Yes.
And so she's brought some great insights, and so it's always been wonderful having you have that background. How many years were you a dermatology nurse?
About 8 years.
8 years.
About
Okay,
8
8 years, and so that's fantastic. And before that, you used to work in the hospital?
I worked in the OR and recovery room.
In the recovery room.
Yep.
Fantastic. So it's always great. So for those of you who don't know, Mary is really a major part of our Dr. Tom Cosmetic Surgery, not only doing medical aesthetic treatments for our patients, but when we are in Maui, she is our operating room nurse. She kind of does everything. She's the Nurse Friday, if you will, and I really appreciate it. Today, Mary, I thought what we would talk about, and since I was lucky enough to get you on the show, is to talk about what are your kind of favorite treatments? What are your 3 favorite treatments for our patients medically in terms of getting results, long-term results, maintenance, however you want to couch it? What are your 3 favorites?
That's like choosing your favorite child.
Okay,
Because
all
we
right.
do so many things that I love and I'm passionate about. But what comes to top of mind is probably the neuromodulators, Botox and Dysport, are very high satisfaction and with very nice results.
So, and neuromodulators, you're sort of one thing about
Yes,
Mary that I
I
really
know.
love. She's awesome, loves education, really scientific, nerdy like me, and so that's really great. So, the listeners, what do you mean by neuromodulators? Everybody's heard about Botox and Dysport. What do they do, and why do you like them so much?
Right. So what they do is relax the muscles that we injected into. So it keeps you from getting lines and crinkles in your skin.
Okay.
It can also, you can inject it in such a way where you open the eyes more, people look more rested, more approachable, and it makes people feel more relaxed.
Right.
Yeah.
So, so neuromodulators, in fact, so it basically modulates the nerves that go to our muscles and helps to relax the muscles, as Mary was saying. And you talked about opening up the eyes, and I talk about that a lot on the show. And so what areas do you inject Dysport and Botox in order to, quotes, open up the eyes?
Well, firstly would be what we refer to as the frown line, so the area between your eyebrows. We relax those muscles that pull the brows down and together and gives you what a lot of people refer to as the 11s. So when you relax the muscles that pull down and together, it lets the muscles, they all work together.
Okay.
267 muscles of the face or whatever it is.
Okay.
Lets the muscle that lifts the brow not have another muscle pulling against it. So it helps to lift the brow up.
Right, it's amazing. So as Mary is describing to our listeners, and again, I want to always need to make sure every show that I thank our listeners. As we were driving over here today, Mary's comment was that there are still a lot of patients who come to us who listen to our show. So I want to thank you to know that that part of our educational outreach has been effective. And again, I so appreciate. How many years have we been together now, Michelle? Where can I cast
I
her
feel
out?
like 17, maybe more.
17 years. So, oh my God,
She's beat me out.
16, 17, kind of like that with Mary here as our lead nurse. With the neuromodulators, your comment is that you get these other reactions. So you relax one area, another area
Yes.
pulls a little bit more, and so that's that's the advantage of going somewhere where they really study the face, know how muscles work, and understand sort of the nerdy science behind it all.
Absolutely.
Okay. All right. Because a lot of times patients will be a little bit mistaken. They'll say, well, I see this line here. Can't you just inject right there? And in fact, it might make it worse.
Correct.
Yeah. So you mentioned between the eyes. Is there any other area that you inject to kind of open up the eyes a little bit more?
The other area that I like are the crow's feet, so on the sides of your eyes. So it helps to open up the sides of the eyes, which can lift the brow as well.
Okay, so those are two really key areas. A lot of times when people come to us and they want Botox or Dysport and they want their eyes to be open more, they don't quite understand that. So, we have to go through the process of explaining how muscles work, where they constrict, where they don't contract. I should say contract instead of constrict, and helps to open up the eyes. So you're talking about the frown and the crow's feet area. In terms of Botox and Dysport, where would you rank them in terms of popularity of all the treatments that we do?
I would say it's almost number one of the injectables.
Okay.
Would you agree?
I do agree. Actually, across the nation, whenever you meet with, or not meet, but if you study the American Society of Plastic Surgery data, every year they release it as to what are the most popular cosmetic procedures. They've divided it into two. One of them is surgical, and a lot of times with surgical, it can be liposuction, eyelid surgery, blepharoplasty, or cosmetic breast surgery. Those three kind of alternate being number 1, 2, and 3. Facelifts and rhinoplasties after that usually. And then there are medical ones that they list, and for decades now, number 1 is Botox and Dysport. Exactly what you say. So I would agree with you. And I think best bang for someone's dollar, and everybody's talking about the economy and it's a little tough right now. One of the best bangs for your dollar still is to inject the frown area to help to open up the eyes, make us look a little bit happier, a little more well-rested. So I agree with you. How often do you recommend that patients come in to have Botox or Dysport?
Generally 3 to 4 months. Seems to be the sweet spot.
Okay, so three plus times a year is what you do. Okay.
Yes.
So besides Botox and Dysport, what else do you find to be, that your patients really love, why they keep on coming back to see you?
Goodness gracious. I love anything that stimulates collagen and elastin. So I think for today, I would go with microneedling. I'm really a fan of microneedling, which catchline is collagen induction therapy. Sounds like a fancy name, but it stimulates your own body to produce more collagen.
Okay, so what exactly is, so you're talking about collagen in the skin.
Right.
Okay, and we all want that, and especially I'm a baby boomer, you're a Gen Xer, I think, right? Are you a Gen Xer?
I think I'm a boomer.
Are you a boomer? Okay.
I'm on the edge, hanging on.
What are you, Michelle?
I'm Gen X.
You're a Gen Xer. I think, Mary, you're in the middle. You look like you're a Gen Xer to me. Okay. So, we talk about collagen, and we'll all look at our skin over time. When we're 20 and in our early 30s, we usually think, we're going to look like this all our lives, right? And then all of a sudden we get hit with the age stick and we realize that, our skin's not looking quite as robust and so forth. And a lot of that is due to loss of collagen. And you mentioned elastin, in our skin. What is microneedling and how does it induce collagen production?
So microneedling is a treatment where essentially we make little tiny holes with this little handpiece in your skin, and that controlled damage stimulates collagen growth.
Okay, so you're just going to take a needle and stick it in my face?
Yes.
You can tell we've been working a lot together, can't you? Always giving me a hard time. Okay, so for the paying customer, the patient who we're trying to be kind to, what do we do for those patients to say, hey, I heard about this collagen induction therapy from that mean lead nurse, Mary, who's giving Dr. Tom a hard time. What can they expect?
Okay, so I'm the nice one.
Okay, all right, you're the nice one.
So we will use a topical numbing cream. So they'll get a numbing cream on their skin for 30 minutes, and once we remove it, the procedure is fairly comfortable.
Okay.
Yeah.
So you put on a topical anesthetic, and then that's taken off, I'm going to assume.
Taken off.
And then is anything else applied after that?
The area's cleansed, and then we'll start with the needling. In addition to our treatment, we do use PRP. So PRP is platelet-rich plasma. So we'll basically do a blood draw, 1 tube. People ask me, how many tubes are you going to do? It's just 1 tube.
Okay.
And it's all a closed system. We do it within our office. We basically spin down the blood, and it makes the red cells go to the bottom, and you have on the top all your plasma, which is yellow. It's not red.
Okay.
And we will apply that as we do the needling of the skin. So the needles drive it into the skin, and we can do it at different levels. So we can drive it at different depths, which I really love. So that helps to reduce the recovery time as well as stimulate more collagen.
So if as we kind of hopefully continue to repeat this for our listening audience so they can understand this. So part of microneedling is topical anesthetic, and then we have a pen that glides over the face. We do use a hyaluronic serum on the skin, so it kind of slides over the skin a little bit more easily, and it's basically aerating the skin. So
Right.
so think about when you have your lawn aerated. I'm not a golfer. I golf about once a year, but if you're going on the greens and you see that there's holes in the greens, so basically we're causing these little holes, so we're creating damage, and then if nature's good to us, it heals. So what's so special about the serum? You mentioned drawing blood and then placing it on the skin so it's driven into the skin, or it soaks into the skin through these aerated holes. What's the magic of the serum?
What is the magic?
The
of this?
magic of the serum, the PRP, right?
Um,
I've thrown you here. Okay, so basically the serum is that it has platelet-rich plasma, right? And that platelet-rich plasma helps to bring in growth factors, helps bring in fibroblasts, and is a key component of, what did you call the procedure? What does it do?
Collagen induction therapy.
There you go, collagen induction therapy. So it's the PRP that's in the plasma that helps. And so we initially use, go ahead, Michelle has a question.
I do have a question. You said that you can do this at different layers of the skin. So really, like, how deep are you talking about when you are doing the microneedling? What's like the most superficial to the deepest that you would do?
We can barely just puncture the epidermis, or you can go down to 2.5 millimeters.
And so what would be the reason that you would go deeper than versus not? Is it just where you are on the face?
Yes, it's
Okay.
dependent on the thickness of the skin, or if I were, say, treating scars, that needs to be treated fairly deeply and aggressively. But primarily it has to do with what area you're treating. For instance, around the eye is very thin skin there, so we'll do not as deep of depth there. Around the lips, maybe where people have those, what do the people refer to
Smoker
those?
lines,
Smoker lines,
right.
or there's something else. Anyway, so you can go fairly deep there to try to get some improvement from those lines.
Right, so the difference, and we have different depths that we'll go into, and that's where it's just not one depth for the whole face. Okay, so that is an advantage. I know that sometimes there's they call them the home gamers, where they try to get the over the counter kind of device and do it on themselves. I don't know how people do treatments on themselves. I've been at this game for so long that when we first started doing Botox and Dysport, we were trying to inject it ourselves. Let me tell you, that was I should have had a video of that. By the way, we're going to be on YouTube for the show, so if you want to just go on YouTube later this evening, I should have it downloaded for us. And trying to inject yourself, I don't know how people do that. Plus, I'm a weenie, so that makes it really hard to do. But nonetheless, the reason that you come into an office like ours, where our staff is highly trained, and Mary's training the majority of our nurses in this type of treatment, is that you're assessing different parts of the face. And Michelle, that was a great question. Mm-hmm. So how deep do we go? So we go a little bit more shallow, you mentioned, Mary, around the eyes, and areas where maybe the skin's thicker, we go a little bit deeper.
Yes.
What about, you mentioned the vertical lines, the sort of the smoker's lines that people talk about. Nothing really works great for that. The best is prevention, obviously, but if you do have that, what do you try to do in that area with the microneedling?
I'm usually trying to go as far as microneedling. Generally as deep as I can.
Deep as you can. So
Yes.
you're going really aggressive. And then you mentioned scars. So we're talking about patients who've had acne scarring.
Mm-hmm.
That can be one reason. It's the most common reason, right? What do you do for those particular patients?
Where the scarring is, I can go deeper, essentially, and actually go more passes. So this little handpiece makes so many holes in the skin, but the more passes that you go, you get more holes in that area. So where the scars are, I could just do more passes, go deeper, and yeah.
And so you're focusing more aggressively in those areas. So very much like if you're in the construction world or you're used to building things, you have a hammer and you know how to use your hammer, but you need to know how to use it correctly. Where you use it delicately, where you really go whack away with it, and that's really it's the same thing in terms of our treatments. Constantly assessing, reassessing, evaluating, and then modifying the treatment for that. So microneedling with PRP, we call it platelet-rich plasma that you had mentioned, the blood draw, which has the growth factors, the collagen-inducing factors for those areas as well. So we talked about Botox and Dysport for as one of the most popular treatments. We talked about microneedling for collagen induction therapy, as you mentioned. What would be your third favorite procedure?
Oh, goodness, I would say our broadband light treatment. So it's not a laser treatment, it is a light treatment that targets the browns and the reds in the skin. But also what I really love about it, it does stimulate some collagen.
Okay, so as Mary described, we call it BBL, okay, and it doesn't stand for Brazilian butt lift, okay? It stands for broadband light, okay? And the original, I'm going to say version of it, was the IPL, which was intense pulse light. And we were one of the very first offices to introduce what we call photofacial or IPL treatments way back in 1999. I went to go visit Dr. Bitter Sr., who's one of the founders and the frontier of laser therapy for the skin, and we brought that here to North Bay, Santa Rosa, and Napa. And as you mentioned, it treats both the brown pigmented spots and reds as well. What does the treatment kind of entail? What should a patient expect if they come in that are going to have a photofacial?
We'll have the patient wash their face, we'll take some photos, and then we will tape off their brows because this light is attracted to pigment too, so you don't want it to remove hair.
Okay.
And they'll get eye protection, and then we use a thin layer of ultrasound gel, like ultrasound gel when you get an ultrasound for your baby. So
Okay,
the same
all
thing,
right,
just
okay.
a little bit of the gel, and we pulse over the skin. It feels like a little snap, and we'll work in sections, usually do one whole cheek, remove the gel, go to the other cheek. The whole process takes maybe 20 minutes once you start doing the pulsing. And then once we're done, you get a calming cream and some sunblock. So it's fairly easy.
Right. And so what should the patients expect after this treatment in terms of, let's be a little more, I'm going to be more specific.
Okay.
When a patient comes in and they have brown spots, sun damage they have on their cheeks, and maybe they have a few little spider veins around their nose.
Okay.
I think that's a common concern. What can they expect in the next few days and the next week or so?
So after treatment, the dark spots get darker. They get darker at first, and then they sort of come off like coffee grounds. So things look worse before they look better, although there really isn't any downtime. You can wear makeup. I've had patients come in on their lunch break and put their makeup on and go back to work. But it does take a couple of weeks at tops for that totally to resolve. The veins usually, a couple things happen. Either immediately it just disappears and we all do a high five and I think I'm the best nurse in the world, or sometimes they turn dark, and that could take 2 weeks as well.
Right.
So
this is a treatment you don't want to do right before your high school reunion.
not right before.
Not right before. Okay, so if we thought, okay, I have sun damage, I have some spider veins on my cheeks, around my nose, and I want to have this treated, how far out before, let's say, an event should we do this?
I usually say 1 month.
About 1 month.
I say 4 weeks, just in case on, less than 1%, you get a bruise. And that
okay.
could take 14 days to
Okay.
yeah.
Okay, so that fair enough. So about a month with that. Let's go backwards, and we were talking about microneedling and PRP. How far in advance to an event might you recommend that?
I would recommend having a series of 3,
Okay.
at least, spaced a month apart, and the last one probably being a month before your event.
Before your
That would
event.
be ideal.
Okay. interesting because I've had it done. You've trained a nurse on me, and I
Yes.
showed up the next day at KSRO to do a show. I remember that many years ago.
Right. Well, I'm thinking more along the lines to realize the effects of the treatment.
Okay, the effects. In terms of downtime, though,
Yeah.
a day or two?
A day or two is fine.
At most.
Yes.
With the BBL, in terms of downtime, in terms of getting back out into the world,
They can
go right back to
right
work.
back to work,
Right
wear
back
their makeup.
Okay, very good. So interesting as we were, Mary didn't really want to tell me what she was going to say, so that everything would be surprised and be, very fresh, if you will, non-rehearsed for the show. And she was asking me about, maybe what my favorite three were. And it's interesting, Mary, that the last two, you surprised me a little bit in that you went from injectables, which most people think of cosmetic medicine as injecting Botox, Dysport, injecting fillers, and all the new fillers and biostimulatories that we have that you and I love to do. But even though you really love to do those things, you move towards skin health. And it's interesting because I find that as my career has evolved, that I'm moving in that same direction. That skin health makes a huge difference for patients. It's probably one of the least expensive things that we do.
I would agree.
And maybe some of the best bangs for your dollar, and it can be the best long term for your overall cosmetic appearance or your aesthetic appearance, is taking care of the skin.
Yes.
So for me, you mentioned I love microneedling. I think it's great. In fact, I need to get another microneedling myself as owner, and as you know, as lead nurse, we don't get our treatments
I know
enough,
somebody
right?
who could do that for you.
But somebody could do it, so maybe I'll have Jessica,
Yes.
Nurse Jessica, do that for me. I need that. I absolutely need another BBL as well. But one of the treatments that I really like, and it's not, and you perform them as well, is the VI peel. And we just had that conversation with Hillary, I think it was last week, where we were talking about VI peels, which doesn't stand for very important peel, but it actually stands for Vitality Institute peel. And the VI peel is really a great peel for taking off sun damage. And so I was hoping, I just didn't plan it right because I hardly ever get myself these treatments, but I planned on having it done with Faith, who is our patient coordinator and also is an esthetician, and I was hoping to get it scheduled, but I'm going to be in Maui with my family in a week and a half. So the VI peel is great in terms of taking off that sun-damaged skin. I'm feeling my skin, it's feeling rougher, and I kind of look at it, I can just sort of see the sun damage that's there. And as I ready to move into another decade with my birthday coming up, I really thought that would be a great treatment. But in terms of my own planning, I'm just like every patient. I'm not planning well enough here. I need to wait till I have at least, I think, 2 weeks before I'm on a trip, don't you?
Yes, I would agree.
At least 2 weeks. So I had to postpone that. And I'm going to get a VI peel. I love the VI peel in terms of the fact that even though it's our most aggressive peel, Mary, it doesn't hurt at all.
It does not hurt at all.
It
I would
doesn't
agree.
hurt at all. And it's our most aggressive peel. And it's the way that it's created, the way that they set the pH, which is the acidic base ratio. Right? You can see I'm a scientific nerd, just like Mary, that it really doesn't sting at all. But you get this significant peeling of that sun-damaged skin, and it really gives you that fresh look. So of the treatments that you had mentioned, what might you combine with the VI peel that I'm mentioning?
I think both microneedling and the BBL could benefit from that, but probably the BBL could benefit most.
I would agree. So the peel is going to help to exfoliate aggressively the sun-damaged skin, and then you're following up with the BBL, which you said treats browns, but you mentioned it also treats reds, right? And so sometimes a little bit of downtime with a peel is that you can be a little red afterwards. So I think that helps to soften the redness of the peel. But it also, especially not so much for me being Chinese and Greek, but for maybe the Northern European blood types, the skin types, that it could really help with the redness that a lot of those people complain of as well.
Absolutely.
Right. So I'm excited to see that we're both on the same kind of trajectory in terms of what we're recommending. One thing that I think is an advantage, and Mary, thank you for coming in here and joining us today. One of the advantages that you have with working with you, because you have 15, 16 years experience working together at initially we were called the Aesthetic Laser and Vein Center, and now we've kind of changed the image a little bit to Dr. Tom Cosmetic Surgery. But you also had how many years as a dermatology nurse?
8 years.
8 years as a dermatology nurse. Is that we've been through this, and we know now that the latest and greatest always isn't the latest and greatest, right?
Right.
And we study this, and sometimes we even smile when something new comes out. We say, yeah, let's see how this pans out before we're going to do it on our patients, right? Or even on ourselves, because we test ourselves first. But it's really an advantage of having your experience. So I want to thank you, because it makes a huge difference. That's why you're so popular, why it takes 4+ weeks to get in to see you, because patients love having you here. And I just want to thank you publicly on air,
Okay.
Mary. Mary
You're most welcome.
Dreyer, for being part of our team.
It was
Thank
a
you
pleasure.
very much for being on the show with us.
All right. Well, you heard it from Mary and Dr. Tom. If you want to book one of these treatments, now is the time to do it. They do book out in advance, and especially if you've got an event coming up, there's months that you need to figure out, like timing and all that kind of stuff. So please reach out to Dr. Tom. It's very easy. You can either head to his website at 707-542-8346, or the website, of course, is Dr. Tom Cosmetic, drtomcosmetic.com. And be sure to vote for Dr. Tom and his team for the Press Democrat Best of list. This is the final week. Thanks so much, Dr. Tom. Thanks, Mary.
Thank you, Michelle.
Thank you.